Hi, my name is Amanda Panacea, and you're listening to the Healer Revolution podcast. This is a community for self-healers, biohackers, practitioners, and any other helping professionals. You're in the right place if you're seeking conversations about how pain becomes passion, the connection between physical, energetic, mental, and our spiritual self, finding your body's ancient wisdom, the latest biohacking technologies, clinical research, and if you just want to nerd out about complex biochemistry and quantum physics. But this is also for entrepreneurs who seek infinite abundance and a supportive community. So pour a cup of King coffee or Sisters tea and let's join the revolution. Welcome back to the Healer Revolution podcast. I am your host, Amanda Panacea. Today I'm joined by Dr. Jeff Gross. He is a spine fellowship-trained neurological surgeon, regenerative medicine expert, international speaker, and founder of ReCELLebrate with CEL at the center of that. He has a background in biochemistry from UC Berkeley and a medical degree from George Washington University. And he has spent years working at the forefront of precision and regenerative therapies. In this episode, we're going to cover some really fun, new, advanced stuff, such as regenerative medicine and biologics. We're going to talk about exosomes, stem cells, peptides, and bioregulators. We go into how they differ, when they're appropriate in this field of regeneration, but we're also going to discuss important and often overlooked topics such as who should not be using these things, cancer risks, and why certain regenerative therapies may be contraindicated. Also, why what Dr. Gross uses instead if safety is a concern. If you're curious about what's actually working in regenerative medicine right now, like exosomes, stem cells, cell factors, the worlds of peptides, and what approach to use with caution, this conversation is going to be packed with insight. Hello, everyone. Welcome back to the Healer Revolution podcast. I am Amanda Panacea, and today I am really thrilled to be able to sit down with Dr. Jeff Gross. Dr. Jeff, I'm so excited to talk to you because you have such an extensive history and qualifications that I don't think I've ever sat down with someone that has a background like this before. So thank you so much for joining me today.
Thank you. I'm thrilled too to meet you. As I was saying before we started the recording, I can't believe we haven't met yet because we have so many overlapping interests and areas of pursuit to help people and probably know a lot of the same people. So it's great to be here. Thank you.
Yeah, of course. My pleasure. And for sure, I think all medicine is really going in the direction of like cellular health and the information, the inputs that we give it. So I know this will be a really fun conversation and my audience will absolutely love it.
Great.
So tell me a little bit about your background. Where did all this start? I know you've got a lot of like formal education, a lot of degrees and practices under your belt. Tell us a little bit about your timeline.
Yeah, I mean, I'm a medical doctor. I have a residency and fellowship in neurosurgery, spinal biomechanics and surgery, with a fellowship, and I practiced, in that field for decades. I still do a little bit, but my whole medical professional world sort of got reimagined, re-engineered, or what are the Disney Imagineering got reimagineered, that's what they say, right? So, and I had always had an open mind to that. I had never been the mainstream Kool-Aid consuming neurosurgeon and was kind of felt I didn't fit in to those guys who so much. So my patients were encouraging me to look into stem cells because they didn't want surgical options, or at least wanted something else first. So I always liked that because I was very non-surgical in my practice to the extent I could be. And then I have a background in biochemistry, molecular cell biology, but you kind of put that aside after med school and you don't really tap into it much. You're not looking at root cause so much, even though we looked for root causes of pain in the spine. and the nervous system and other things, not at the cellular level like I'm doing now and like you do. So, one year, probably about 7, 8 years ago, instead of going to a neurosurgery conference every year to get my, annual education credits and listen to the same old stuff, I decided I would go to something different. I would go to a stem cell conference. And, I had studied those as an undergraduate, but so much had changed in the 30 plus years since then. And I got reawakened to all those changes. A lot of the clinical medical evidence, and there's great evidence on this, right? And it comes from Europe and it comes from Asia. And that's why professional athletes were leaving this country for decades to get treatment. And I found out it's being done here. And if it's done properly and compliantly and carefully and with the right sources of materials, we can apply regenerative medicine here. So that reopened my application for patients with spinal problems. But now, a few years down the road, I do so much more than spine and brain. I'm doing joints and I'm doing, inflammatory health, cellular health, and stem cells and exosomes and secretome and peptides and so many things that should have been part of my toolbox for years, but were suppressed by big pharma, big implant industry that wants you to do surgery. So I put down the Kool-Aid, and that's what I do now. So I'm way more integrative, functional, closer to what you do than I've ever been.
Awesome. And was there any like a certain case that really inspired you to look outside the box? Like were there people that just weren't getting better and you kind of lost hope in it, or was there any sort of catalyst?
There wasn't any one case. I think it was just an accumulation of frustration with the status quo, with
Hmm.
the lack of advancement, because what I was trained to do surgically has not changed since the 1940s. So we're
Wow.
either, opening the spine, making more room, and or fusing the spine, locking bones together. That hasn't changed. Yeah, there's a new smaller incision or a microscope or a new widget to put in there. The same approaches are there. So moving to backing up a few steps into what can we do biologically, made so much more sense. I've been wanting that for so long. I've been longing for it. So I finally just took the jump, and it's opened my world to being able to offer people things that I should have had access to earlier, but the education status quo prevented that.
Yeah. And so do you know, maybe you don't, or maybe you do, if the current curriculum is now opening up to teach these now that there's no? Okay.
I,
You're
it,
shaking your head.
well, I can only speak for MD
Uh-huh.
medical schools, that
Yeah,
degree,
yeah.
and I don't think so. I would love for there to be some education there, and I would be happy to be part of it. I'd be, wouldn't take much to give a few lectures at a medical school, and or provide a curriculum, that these are here to stay. I think orthopedic, neurosurgical, musculoskeletal, sports uh, medicine residencies should include this as a
Mhm.
as a minimum to start, because it's here to stay. It's growing, and you don't have to leave the country to get it.
Yeah. Yeah, because I find that in my field, I mean, even when I got my original counseling master's, which was about 15 or so years ago, we didn't learn anything about the nervous system. And we still to this day in like psychiatry and documentation for therapists, social workers, there's still no speaking about the nervous system at all. And I just find that so wild that this information has not spread into like higher level education. And I need to kind of look into it. Like, is this even being taught right now currently? Because I've spoken with like interns and people that have just graduated and they're still, they still don't have that basic understanding. So
Yeah.
it's crazy that I'm sure you know the statistic. It's like 18 to 20 years to go from like research into actual the education system when things start to get integrated. So we're really behind on how we train people.
We are very behind and we are very slow, even
Mhm.
though we used to have the most advanced, medical system in the world, it is so watered down because the money is sucked out by the sick care insurance system. United Healthcare makes more in a day than they pay out in a year.
Wow.
Yeah, so run out, buy some United stock because they're
Yeah.
making 365x plus.
Yeah. Fun fact, I worked for an insurance company and now I do not have health insurance. I do like crowdsourcing. Because of that reason. I just saw like how broken and how backwards it was for many, many years. Um, so anyways, okay, so let's get back into like, okay, you were doing neurosurgery and now you've gotten into stem cells, exosomes, peptides. What's the difference between stem cells, exosomes, maybe even peptides, if you want to throw that in there?
Yeah, well, stem cells, we'll start there. So we're made of cells. Our body's made of cells, and when we were starting out as an embryo and a fetus, we were made of stem cells. Those cells give rise to all the other cells, and in fact, you could say our cells all stem from these original powerful cells. And there are many different types of stem cells. An embryo starts out with the most powerful type, but by the time we're born, we're left mainly with what we call multipotent cells. So they can do a lot, but they can't make a new human necessarily unless they're, put into a lab and encouraged to go backwards in their time lineage. But we maintain these as children and adults. They help us grow and develop. They help us heal once we're fully grown. They help replace tissue. We're always making new skin cells and liver cells and things like that. And if you're injured, it helps you replace and heal. But as we age, we lose the number of the cells of these stem cells. We lose the quality because, as you know, our cells get exposed to a world full of pro-inflammatory stressors, whether it's in the food source, in the water, in the air, electromagnetic fields, bad thoughts, lack of exercise. So you and I could make a longer list, I'm sure. And I know our stem cells get exposed to those detrimental, effects as well. So the strategy of regenerative medicine is to use those stem cells from a younger, donated, safe, ethical source to help an older person or an inflamed person repair at a younger pace. And that's the strategy. As it turns out, stem cells really aren't doing the job. If you came down to the clinic in Las Vegas here, Amanda, and we gave you an IV full of stem cells, they'd be out of your system in days, probably some of them sooner. But the benefits would last weeks or months, and some benefits are permanent. So if the cells are gone, what's happening? Well, those cells imparted a signal to our own cells. And that signal is in two forms. One, stem cells make growth factors. These are good cytokines, good chemical messaging to our cells that help influence the behavior of our cells. They bind receptors. Some of those growth factors go inside of our cells. And then the other, probably more efficient modulator of that signal message from a stem cell is through a small extracellular vesicle, a little outbubbling of a cell, 1/1000th the size of a cell, and it contains microRNAs and peptides and heat shock proteins and all this goodness. It's a message, and that's taken in by our cells, so our cells can go, oh yeah, that's a reminder to behave more youthfully, to heal and be more restorative and stop goofing around with the inflammation nonsense. So that small bubble is called an exosome, out of the body, meaning out of the cell. And that a stem cell derived exosome is a generic good message. And so when we talk about exosomes, we're really talking about something in that realm. Peptides are a little bit separate. Peptides are really short proteins that have signaling characteristics. The vast majority of these are naturally occurring. That means our body makes them. And just like our stem cells get depleted over time or not as functional over time, our ability to make hormones and peptides get depleted. And sometimes you have to help replace them to get a restorative boost or achieve a certain health goal at the cellular level. So we're talking about cellular medicine, as you know, and suppressing inflammatory degeneration at the cellular level so that our cells can function as they were originally designed at a more youthful rate.
Got it. And then are you using also peptide bioregulators, like the Russian bioregulators?
Yes, so a subclass of peptides are even smaller protein, usually two or three amino acids long, and they usually are derived from or glands in the body, and they can be used to help restore gland function in a more youthful way. So yes, we're using all kinds of different bioregulators. In fact, I'm just putting together a sort of like a 12-month kit of bioregulators and restorative peptides that someone might do throughout the year, and some of these bioregulators you might use for a cycle, then go off for 6 or 12 months and go back on. So this would be sort of a recurring kit. You do epitalon for a month, you do thymosin alpha 1 for a month. So I'm working on putting that together to make available to people.
Awesome. Yeah, I have some sitting on my desk right now. I'm doing the ovary and the thymus bioregulator. I try
Excellent.
to do like at least two or three at a time and then cycle off.
I do as well.
Okay, cool. So I really feel like there was this big shift from like you have to detox in the health space to now it's more like cellular regeneration and some of the things that you just mentioned. Um, with that shift, with like, okay, we're going to regenerate, we're going to send the right signals. Like in my world, as also a therapist, I'm like, we have to send the signals of safety. Sometimes that can be biochemical, sometimes that's bioenergetic, sometimes that's spiritual, emotional. How are these tools going to be helpful? Or do people still need to detox? Like, do they still need to maybe go down the binders and the
Yeah.
chelators, or is
Oh, yeah.
this something that like totally replaces that whole method?
No, no, these are both necessary pathways. We need to clean up the
Mm.
cellular junk. And sometimes that requires lifestyle changes into an anti-inflammatory lifestyle. Sometimes we have to clean up the garbage that's left on the street side there of the cells by various types of detoxifications. You'll get more out of the regenerative approach if you're able to clean up first. So often we get people sort of prepared, prepped, primed with different types of approaches that involve a detox.
And obviously, it wouldn't replace like if you're really nutrient deficient, malnourished, like it's kind of like you need all these pieces to kind of get the most out of them.
I think so. We want to have a holistic approach,
Mhm.
comprehensive, thorough approach. So we look at all the different aspects of lifestyle, sleep and diet and nutrition and supplementation and hormesis, like fasting and hot sauna and all kinds of high intensity exercise and the mental piece, breath work, the meditation, whatever that means for someone, because it varies. Um, all of that. We want to help that person meet their health goals, not just their needs, and that requires input. We can't just have people come in for exosomes like it's a magic pill. That's
Yeah.
unfortunately the American way, right? Just the quick fix, and that's not how it works. If you want to have a health span and goals towards healthy longevity, really have to do the work.
Yeah, I think that's what I was getting at is because I've worked with some clients who have come to me and said, like, I did exosomes and I didn't have results, or, they come to me and we're going over their history or they're filling out the intake, and there's so many lifestyle pieces and like low-hanging fruit that I'm like, man, did anyone explain how this works and like what you maybe needed to do to prepare for it? um, before you actually got the exosomes or before you do something as intensive as that because it's still pretty pricey of an intervention. So I think that that's what one thing I want people to take home is like, yes, these things are powerful. Peptides are all over social media now, but it's not going to solve all your problems.
No, that's a great point. But if I can clarify a few points, I do a lot of
Mhm.
second opinions. People have had exosomes somewhere else, maybe
Yeah.
not gotten the result. So you got to look at the quality and the quantity of what they're getting. And sometimes I hear people, oh, I got 50 billion exosomes. That's nothing. We're doing, trillions of exosomes. Also, I have people with like knee pain, and they've had an injection in the joint space. And we know that's far less effective than having an injection in the subchondral bone. So when we look at joints, we're very specific, and there's excellent literature with 15-year follow-up out of Europe showing that the intra-articular injections over time just don't do as well. And
Okay,
for
yeah.
those listening at home, intra-articular means in the joint, in the meniscus, in the cartilage. The cartilage is barely alive. It's barely has cells. It's the protein product of the joint space. Just like hair is the protein product of a follicle cell in the scalp, cartilage is a protein product of a cell in the bone edge called a chondrocyte. So we want to stimulate the chondrocytes, not the cartilage. And in terms of cost, these have come way down. Luckily, the exosome-based biologics are a fraction of the stem cell cost. Plus, you're not getting anyone else's DNA when you get exosomes, whereas you are with stem cells. Not that that is an issue necessarily, but some people have an issue with the concept.
hmm Yeah, that was a big question I had for you is this someone else's DNA and how does that work? What are the risks? Is there any kind of answer that a little bit?
Yeah. Yeah, we should explore that. So I source, everyone sources material differently. There are tons of labs in the US that source. I source from a lab that goes through the American Tissue Bank, which is a highly regulated, agency where they have true donation of amniotic fluid, of umbilical cords, of placenta after a mother has a healthy baby. Okay. The baby has to be healthy, the mother has to be healthy. We choose from a non-COVID vaccinated group cohort because we don't want that variable in our biologics. And then the biologics go to the lab frozen and they remain frozen. They are tested and screened, quarantined for 2 weeks. All the viruses are tested. We get a certificate of analysis of 4 pages with each lot. And I use a lot of what we call secretome, which is amniotic fluid that's filtered and tested. It comes to me fresh frozen. I have a special freezer, and I use it on myself, family, friends, patients, and I've visited the lab, and they meet FDA, certification for following CGMP and all the cleanliness guidelines, documentation, et cetera, et cetera. So although we can't make any claims, any marketing claims, because those have not yet been approved, the process is highly regulated, and I feel that it's about as good as you can get. Exosomes do have short fragments of DNA, but nothing genomic, meaning not a full gene. So you're not really getting anyone else's genes. Whereas with cells, you do. Is that a problem? Probably not. But again, we could take it off the table when you go with the secretome because again, if we gave you stem cells, they're gone in a few days. So why don't we just skip the delivery van and go right to the package, which is what we're doing.
Okay. Yeah, I like that analogy. I've heard someone else use that analogy as well. Like the stem cell is the Amazon warehouse and the exosomes are the packages being delivered and the delivery trucks kind of a thing.
That's fair, yeah.
Okay. Okay. Yeah. And then let's go back to you were starting to mention like, okay, the research says injecting them here is better than here. Are you finding that are you doing IVs? Are you doing local
Yep.
injections? What are the
Yep.
differences and what people need which ones?
Yeah, so I'm a spine surgeon by history, so I got into this to do a lot of musculoskeletal work at first. So I do plenty of joints and spine work. The spine being adding up a bunch of joints of sorts. So we're very specific about how we analyze and target before we'll do an injection. We do high quality MRIs, not a regular MRI. We order off the secret menu. I know how to do this. And we look at the changes in the space that's contributing to the loss of cartilage, the what we call the process of degeneration of the joint, of osteoarthritis. It's the same progression until there's no cartilage left, and that's called bone on bone. And that's when people are facing surgery because it's the next thing on the current, Kool-Aid consumed, sick care model on the menu. So we add a tool in between. Hey, before surgery, let us try a regenerative injection. We target it off the MRI. We do these under sedation, not general anesthesia, but still twilight, and because I have to inject the bone. And we do plenty of those, and it usually takes about 6 to 12 months to see the type of result that's in the publication. So our results are matching those over the last 6 or 7 years, and we have some before and after MRIs where we've shown cartilage regeneration. So it is possible, although orthopedic surgeons are not trained that it is. And I'm not saying exosomes are necessarily better. I think it's the most efficient way to get the regenerative signal at the least cost because the has come way down because amniotic fluid is so much more abundant than an umbilical cord. So you can get so much more out of it. So the cost is less.
Okay. And then what about other types of conditions? Like I know you've also worked with like cancers, and I work with a lot
Yeah.
of mast cell activation syndrome, which is just
Yeah.
broad spectrum inflammation that never kind
Yeah.
of ends up.
Yeah, so we do for people with hyperinflamed states like autoimmune, a mast cell type issue, certain infections like Lyme's and long COVID. We've had benefits by using intravenous or IV, exosomes or the filtered amniotic fluid, which is basically stem cell regenerative biology. Um, I've done nasal spray of the product for brain injury, stroke, Parkinson's, MS, dementias. We've had some benefits there. Nasal spray is easy. All right. We've done a breathing machine for lung issues. I had one woman that I'll never forget in her late 60s, just diabetic, not healthy, chronic bronchitis. So our physician put her on, steroid inhalers and she was, it's affecting her immune system. Her bones were breaking down. So she became oxygen dependent after one uh, bout of bronchitis and stopped leaving the house because you have to drag a little oxygen canister with you. So we did one breathing treatment of the exosomes using a little nebulizer machine, and within a few days she's off oxygen, has remained off oxygen since then.
Wow.
And
For one treatment.
one treatment. So, we can't, again, I can't make any official claims or
Of
as
course.
a surgeon, I've never made guarantees, but it's
Mhm.
worth trying potentially. It's a lot, and then get her off the steroids, which can really slow
Mhm.
down things. So steroids have a role in the acute setting, but sure, we really don't want to be using them chronically. So
Mhm.
if we can avoid it. We also, I do some, like you said, some just local injections now and then, but honestly, most of the good musculoskeletal joint spine work is in the bone.
Okay. And what about people who have EDS or hypermobility? I think you're probably seeing way more of that too. Is that like more of an IV situation, or does it depend on if like they need it in certain ligaments or joints?
Yeah, it's interesting because this is a genetic connective tissue disorder. There is inflammation, so we do get some benefit from the IV. If there is joint degeneration, we would approach it like almost any joint. But people with Ehlers-Danlos or other laxity problems tend to have loose joints, not necessarily degenerated joints. And I don't think the regenerative biology is useful for that. They may benefit from a prolotherapy or something to help build some fibrosis and toughen up the ligaments. So I just haven't seen overall benefits in joint laxity from exosomes, stem cells, that kind of thing.
Okay. Yeah, and what is prolotherapy, or are there other options for people in this category? Because I'm one of these people and I'm always looking for resources for my
Yeah.
clients as well.
Yeah, I don't do prolotherapy myself, but it's
Okay.
injecting a little sugar or salt substance in the ligaments, usually on multiple occasions, to cause a little bit of a scar reaction, a little bit of healing, a little bit of inflammatory response. So the scar tissue tends to be thicker and tougher than the loose ligaments. So you can help maintain some of the joints. So I have some colleagues around the country that do prolotherapy, and they're worth talking to. Maybe that'd be another podcast for you to explore.
Yeah, I'm always, especially for, I think most of my clientele falls in the mass activation spectrum, which also includes like the hypermobility, POTS,
Yeah.
dysautonomia, neurodivergence, chronic stress, trauma.
Yeah.
So I'm always looking for resources for them and ways to refer them for things that are just not in my wheelhouse.
Yeah.
Because it all is like it's a vicious cycle. One problem feeds into the next, which
Yeah.
feeds into the next, which feeds into the next.
Of course. We see that with the joints too, right? The knee
Yeah.
goes, and then the hip, has been affected because of the asymmetric forces. So we see that,
Hmm.
that's why they have that song you listen to over Halloween, right? The hip bone's connected to the, etc. So, don't make me sing it.
Sure, I will. And then what about cancers? Is there research for exosomes
Yeah.
with certain types of cancers,
Yep.
and how is that supported?
Yeah, so we're moving into a realm of specialty or discrete, distinct types of exosomes. So
Hmm.
right now, when we use the word exosome, we're really talking about stem cell derived exosomes. But for cancer, we don't want to use a growth signal. So we have uh, tapped into the immune system. As you know, one of the most important cells in the immune system is called the natural killer cell or the NK cell. And it's only 1 or 2% of our white blood cells. So it's just a very small proportion of our immune system. But those cells are really important because they selectively identify and remove abnormal cells, infected cells, um, you know, zombie senescent cells, and tumor cells. Because we make tumor cells accidentally during our life and they get removed by the system. Well, if you look at a spectrum of cancer patients, their NK cells are reduced in number and reduced in function. So it occurred to me, and I'm not the first one it's occurred to, that, well, if we could restore their NK cell function and quantity, maybe we could help them fight the cancer with their own immune system. So it's a type of immunotherapy. And there are some advanced protocols involving extracting NK cells out of the body in a lab and growing them in a petri dish over time and enhancing them in different ways and priming them and putting them back in the body. That's, hundreds of thousands of dollars and hundreds of man hours, and it's very challenging. Well, I think it's easier than that. And NK cells kill their target cell, in this case, a cancer cell, through their own special exosomes, would you believe? Of course, right? That's the ammunition. And those exosomes contain certain enzymes that are known to cause a tumor cell to rupture, to lyse, to open up. So you can get natural killer cell exosomes finally off the shelf. It's very difficult because by the time you collect enough NK cells and then you have them produce the exosomes, it's very difficult. So they were only available in a couple labs, one in Europe, one in China, and I've been tugging at these labs for a couple years. And finally, last January, so it's been a year now, I got the first um, amount. So they had 40 doses available in Europe, and I bought 10 of them. So here in Nevada, we made those NK exosomes available to a number of people. These can be used for anti-aging because they clear out senescent cells. There are great studies on that. There are wonderful studies and medical evidence of treating circulating tumors, solid tumors. They took mice and they put brain tumor cells just under the skin of mice and created a brain tumor under the skin. And then they injected NK exosomes through the skin into those tumors and they shrunk away. So we do that here in the office and in the injection center here in my office in Las Vegas. And we want to make that more available. We're trying to get some additional doses. It's very hard to come by, but that's specific for cancer. We're saving those for our cancer patients.
Hmm. Okay. So obviously, we've all heard the rumors like when people cure cancer, or I'm using quotation marks for those listening, that things like this get shut down very fast,
Yeah,
or the government goes to great lengths to quiet these people. Are
sure.
you worried that's going to happen, or does this feel differently?
I'm always worried that some unjust government
Yeah.
agency is going to do something that hurts my ability to carry out my Hippocratic oath and to help
Hmm.
people and give them the right to try.
Yeah.
But I'm not making any claims here that we're curing or treating a disease or condition, but
Hmm.
this is an augmentative thing to help your body fight the something. It's worth adding to a regimen, or I have some people that just won't have chemotherapy and radiation, and that's okay. We don't judge them. We make these available without discrimination to those who have an appetite for it and are interested in it. We have some people who are in remission from other treatment and want to do some action to help stay in remission. We have some people at risk. Maybe they have a BRCA gene mutation or something, and they want to do something to help them fight the potential of a tumor cell. So there are different logical reasons, and there is great medical evidence to support this, even if it's not yet approved for marketing claims.
Got it. Yeah. That's something I'm always like, because you see that kind of in the peptide world now. They're shutting down online clinics. They're getting really strict about who can talk about these things. I've had a lot of my content removed, and my Instagram went into like the jailhouse just for talking about peptides. And again, like another reason or another way that these government agencies are trying to like silence or keep this pool really
Yeah.
small for what your options are.
Yeah, the government agencies here are acting at the behest indirectly of, Eli Lilly and Big Pharma because of the
Mhm.
retatrutide, their clause on retatrutide. So, they've apparently patented this, or they bought the patents on it or the license to it. So, that's one of the peptides out there. It's a GLP a triple agonist, and it's quite useful. So there's a lot of money. Follow the money there. Um, yeah, and again, shutting down free speech is just horrible. And that's why I want to thank you for having this podcast, because it is sort of the tip of the spear on being able to talk frankly and transparently.
Mhm.
And if the FDA comes to knock on your door, we have these conversations you can use in your defense, where we're trying to help people and we're trying to do it safely and we're trying to do it at the highest quality and the most logic, with less dependence on foreign substances, pharmaceuticals, surgeries, things like that. So this is as close to following the Hippocratic Oath as we can.
Love that. Yeah. So let's walk me through if I was going to come into your office. Let's say I'll give you my own actual history. Like I've injured my back, I'm hypermobile, I've dealt with mast cell activation, I still have histamine issues. I really want to do exosomes and peptides and all the things. What would it look like to like set up a plan, or do you do any testing or any sort of case consults before you decide what's best for someone?
Oh yeah, and we're not going to make a decision with a history like that. We need to get to know each other. So this would happen first remotely. Most of my patients don't live here in Las Vegas.
Okay, that's
Um,
good.
they start somewhere else. We have them send all their records, labs, imaging, and then we start there. We dig into it. We see what their current protocol is. What's your supplement game? What are you doing? What are you not doing? We might tweak some of that to improve things. If the imaging is inadequate, we would order proper imaging for you, which you can likely get near where you live. Um, and we would take it from there and see if there's something we can offer you and what the options are, because the ethical informed consent process requires me to go over all the options. If you came in with a back problem, oh, okay, you could have surgery, you could have cortisone injections. Those are traditional. I've ordered them for decades. They could be useful. They may not be the only option, right? We have other approaches now. So it would just depend. Everyone's different. This is precision medicine. And I'm a bit compulsive being a neurosurgeon, or I'm a bit neurosurgical being compulsive. I'm not sure which came first. So we would want to go through all the details, thoroughly.
Mhm. Yeah. And what would be some like what's a general timeline for getting exosomes? Is it does it vary? Because I've heard some people say like 3 months in a row, or do you just decide that depending on the person?
Let's just hypothetically, you've got this, hyperinflamed situation. Your mast cells are out of control. You've done everything else you possibly can, and now it's time to try an IV exosome. So what we would do is we would figure out a dose based on your situation. We would probably want to do at least 2 trillion, 3 trillion, somewhere in there. And then we would do one IV, and then we would see what you get. We would not make a plan beyond that. We would see, because if you feel great for a year, we may not need to do anything for a year. If you feel great for 4 months, then maybe we need to do something repeated at 4 months. We don't know what your body needs exactly. We just need to study that. So N equals one. Every patient is different. I like to do exosomes IV myself 4 times a year, but I do that more for anti-aging and preventative and inflammation suppression. That's just I have easy access to it. So it's kind of, just have my nurse hook me up. But sometimes I get so busy I forget, the what is it? The cobbler's children have no shoes type of thing. So, but my wife and I like to do it every few months. My mother doesn't live in town. She and my stepfather come in every 6 months or so to get an IV. They're in their 80s. They love it. They get a boost of energy, and feel really good. So, you get some mental boost sometimes. But in your case, we want to clean up mast cell inflammation. So we want to see if we can move the needle in the inflammatory epigenetics of what's going on at the cellular level. And we might
Mhm.
stack that with some peptides you're already using. Maybe we tweak it. A lot of peptide users aren't using enough. We're seeing Wolverine protocols where people are using, 250 micrograms of BPC 157. We have people on 2 milligrams of BPC 157 a day.
Oh,
So it
wow.
just depends.
Yeah. Yeah, I've dabbled in many, many things. I've done all the peptides, but I definitely tend to stay really low and slow because, too much too fast for someone that struggles with mast cell oftentimes will backfire. But if somebody's being, because I do all this like independently, I don't have a doctor or anything like that. So if somebody's being monitored, that seems much safer. And obviously you have other tools in the toolkit. What could
Yeah.
someone expect from getting one treatment? Like, are there people that are non-responders, or does
Yeah.
everyone have
Yeah.
some benefit? Hmm.
Yeah, not everyone has some benefit. Most people do. Expectations might sound like a claim, so I'm going to restate that and say, here are common things that people report after
Hmm.
exosome IV: improved energy, improved sleep, improved libido, improved mental speed, mental um, duration, recovery from workouts, fewer aches and pains. Um, Improve HRV. I have this one guy, I'll never forget it. Young, probably 30s, very active, pickleball, gym, just biohacker, just great guy. Came in, he wanted to try the IV exosomes for anti-aging. He did one, talked to him a few days later in a follow-up. Yeah, he said, I didn't really feel much. But then the day later, he sent me a snapshot of his HRV, which was already amazing, and it went up 50%. He didn't make any other changes. So we know this is helping at the cellular level, right? We've also done age-related cellular age tests, like a glycan age or one of those, and we've seen people get effectively younger at the cellular level from this. So we know even if you don't feel the boosts that most people do, it is helping. Now I can tell you that the people who do multiple ones feel the biggest effect at the first one,
Okay.
and then they start to clean up their system, and it's not as effective. I don't even feel as much anymore as I used to, but I the first time was just wow. I mean, you felt effervescent, you felt on top of the world, and it was just amazing. So these things, you need to have other markers besides how do you feel, but how do you feel is a good one.
Yeah. Yeah, absolutely. I mean, I think that's what everyone like, who cares about what your lab work says if you feel amazing? I think I work with a lot of people who are in that camp, but then there also is the camp who is like, I don't care about anything but having perfect lab markers. I want to see that I'm not aging. I want to make sure that I'm
Yeah.
doing it right, quote unquote.
Yeah, we want some of both. We want the clinical, how
Yeah.
you feel, and the scientific labs. Find some happy medium where we're moving the needle in the right direction for both.
Right, got it. And so you mentioned several times that the price has come way down. And I know you mentioned like it used to not be eligible in the United States. What's changed recently? Why do you think it's become more affordable? Can people find other safe clinics or
Yeah. Oh,
is
yeah. I'm not the only one. There are plenty of us.
uh,
You have to look us up because we're not allowed to advertise. Google and Facebook will shut us down. Um,
Okay.
Even if we do it right and don't make any claims, they'll shut us down. We cannot, if the word exosome or stem cell or regenerative or peptide is in an ad, it gets flagged.
Okay, that
Why
makes
is
sense.
that? I don't know. Ask your congressman and senator. But I think we all know who's behind that. But these have been available and compliant. I mean, it's not recently available. These have been around for many years, but you don't hear about it. What you hear about is Europe and Central America, and you can spend 25, $30,000 and go get a vacation, go to Costa Rica and do this. But the exosomes have come way down, and we're trying to make this available to people. So an IV is just a few $1,000s, perhaps, for just over 1 trillion particles. And then the joint procedures with the surgery center, the sedation, the anesthesiologist, all in. Depends on the number of doses, but anywhere from 8,000 to like maybe 12 or 13,000-ish. Again, depending on the number of doses we're using. That's the biggest determinant of the cost. So it's a lot cheaper than a surgery. There's no downtime. You can exercise the next day or the same day if you want. So there's a beauty to that. You don't have any missed work or missed life, painful physical therapy, risks of surgery, that kind of thing.
Hmm. And after someone has something like this done, are people flying out to see you and then they just go home? There's
Yeah.
not a lot. Is there a lot of risk of anything happening after? Like, has anyone haven't had any reactions?
Uh, People have had soreness from the injection for up to a week, but nothing ice and some Tylenol won't, take care of. Generally speaking, and it dissipates. It's just from the procedure. But no one's had any issues. Are there risks? Sure, we always state the risk. Bleeding, infection. Putting the needle somewhere it shouldn't go. I mean, that's why we use targeting and X-ray guidance at the time of the procedure. And um, decades of experience in how to approach the body and avoid the important structures. So, yeah, of course there are risks. Everything has risks. Walking out into the street has risks, but they're so minimal with an injection compared to a surgery. I used to do big open surgeries, many more risks there.
Oh, absolutely. And what about the IVs?
Yeah, the only thing we see there in a very, very small subset of patients, usually someone who has a lot of inflammation, maybe a mast cell problem,
Hmm.
is there might be a day or so of when the cells are flipping from defense mode of inflammation to peacetime mode, health mode of anti-inflammation or optimal function. It has to purge out the factory inventory of all the histamines and all
Hmm.
these cytokines, these pro-inflammatory cytokines. So they get released into the bloodstream, and people feel crappy for a day. It's like a flu-like syndrome without having the flu because they're all
Hmm.
inflamed because it's got to purge out of your system. So we see that, and sometimes that's a good sign, you know.
Yeah.
So, other than that, no, we haven't had any issues. I suppose there's always a risk of pain from the injection side or infection from the IV, but we're a medical
Yeah.
clinic. We have processes and sterility and aseptic technique and all that.
Yeah. Yeah. I'm just always thinking about my super sensitive mast cell people who react to like one drop of something. And, you know, an IV is a little intense, even like psychologically, they can nocebo effects.
Yeah.
And I'm just wondering if you've ever seen that before. Like, could someone have an allergic reaction to the exosomes IVs?
I don't think I'd say allergic reaction, although they are releasing their
Yeah.
inflammatory cytokines, which
Hmm.
is I want them to. So it's
Yeah.
interesting, maybe some mast cell patients we might start a test dose lower, you know.
Hmm.
It just depends on the person. A lot of these people are taking pharmaceutical, IV pharmaceuticals, Humira, other, they call them biologics, but they're antibody-based
Right.
treatments. And we want to cleanse their body of that first. So I don't want to catch them 2 weeks after one of those infusions, right? The
Oh,
goal
okay.
here is to let their body get resorted at the cellular level naturally so they don't need those pharmaceuticals.
Hmm. Yeah, I did Dupixent for a while
Yeah.
because I had really horrific eczema and topical steroid withdrawal. But of
Mhm.
course, lots of side effects didn't really fully help. Okay, cool. That helps. And then so at a cellular level, what I'm kind of hearing is that it's almost like they're switching off that like cell danger response or allowing cell danger response to complete so that
Yeah.
the cytokines are no longer being produced, the mast cells are no longer degranulating. Is that kind of a correct way to think about it?
That's how I think about it, is we want to
Mm-hmm.
deplete the vacuoles full of that stuff and let the
Mm-hmm.
cell just empty all that and flip its machinery into, a healthy anti-inflammatory mode and then keep it there.
Yeah. Okay. That's so fascinating that it would last for so long because, a lot of people I work with also have a hard time taking mast cell stabilizers and they're just stuck in that cycle. So I feel like this is like such a good next or a first line of defense for some of these people who can't even take the medications needed to stabilize mast cells.
Yeah. And again, exosomes would just be a part of that approach.
Hmm.
We would look at
Right. Yeah.
peptides. We would look at other supplements and other lifestyle factors to stimulate stem cell and NK cell release naturally, like fasting and hot saunas,
Yeah.
stuff like that. Yeah.
Hmm. Yeah, absolutely, for sure. Is there anyone that should not do exosomes?
Yeah, we don't give it to people with cancer. That's why I have the natural killer cell exosomes for them. We don't want to give a growth signal. Although some literature suggests the growth signal from stem cells and exosomes will help the immune system fight the cancer. Because it's controversial and we don't have enough science to go one way or the other, I just don't offer that. Um, I wouldn't give it to someone if we're doing some kind of injection or IV. I wouldn't give it to someone who has a bleeding disorder who's going to bleed on me, right? That would be not smart. So we have people that come in on blood thinners and things like that, and we can do a nasal spray or a breathing treatment, but they're not going to get the same systemic uptake. Um,
Hmm.
those would be some limitations that come to mind.
Okay. And do you test for cancer prior for everyone or
No, no,
okay.
although there's some wonderful now screening tests we can do, genetic screening tests that we may be adding. No, I mean, I rely on someone to tell me that they've had a full checkup and we do some basic blood tests if they haven't had a workup recently to make sure there are no indicators for cancer, no
Hmm.
symptoms that would, potentially cause cancer. We like people to do regular screenings, it's different for men and women, of course, but and colonoscopies and what have you, or some substitute for colonoscopy like a Cologuard or whatever.
Hmm.
Yeah.
Yeah, that makes sense. Yeah, so is there anything kind of up and coming or anything really new that you're excited about in this regenerative healing
Yeah.
space?
Yeah, thank you for that. Of course, I'm a consummate nerd looking at new things all the time. So, one of the challenges in spine is disc regeneration, and the regular stem cells and exosomes just haven't moved the needle. Some wonderful publication in China using Muse cells. Muse cells are a subset of stem cells that have more potential. So we are sourcing some Muse cells, and soon we'll be doing some additional work in the disc, spinal discs, on top of what we're already doing in the spine. We also are sourcing some very specific stem cell type exosomes that are tissue specific and have even more specific cargo RNAs and peptides and things. For example, we do some cosmetic procedures. We do like a vampire facial with exosomes. We do for thinning hair, scalp injections. We now have dermal papillae exosomes that are specific for follicles that we are just getting our hands on. So, and after that, we're going to be sourcing some neurological stem cell exosomes, even better for brain type issues, which you can do by nasal spray. So it's just getting more specific and more dialed in as we go.
It's amazing. I'm excited to learn about that. Awesome. Tell everyone where they can get a hold of you, where they can find your clinic. Do you have like a social media account or
Yeah.
anything?
Yeah, until they shut me down for saying something
Right,
that goes
that's what I
against
was
the
worried about.
big pharma. But yeah, our clinic is called ReCELLebrate, ReCellebrate, celebrating the renewal of your cells. And that is our clinic name. It's our website name. It's our Instagram name. It's our LinkedIn. It's our Facebook. It's our Pinterest. It's everything. X, formerly Twitter, uh, whatever. It's ReCELLebrate. I think we've cornered that word on the internet. So check us out. Follow us on social media If you have any questions, we like to meet new people. Reach out. We love to answer questions.
Awesome. Thank you so much. Well, this has been really, really insightful. I learned a lot. I think I asked all my questions that I had about exosomes. It's been so nice to meet you.
You too.
Any last words about health, healing, people that may be just feeling really down, that just feel like I'm a lost cause.
Yeah, you're not. You just haven't figured out the source yet. So don't give up. Don't
Yeah,
take no for an answer. And then exercise hard.
love it. Thank you.
Yeah.
Well, thank you, Dr. Jeff. It's been a pleasure. Thank you, everyone, for listening. Bye. Thank you, everyone. I am just so thrilled that you're listening to the Healer Revolution podcast. This has been a huge passion project for me and super therapeutic on top of that, helping me to use my voice and connect with other like-minded individuals. So if you're enjoying the podcast, please like and subscribe. Please share on social media or with your audience or friends or loved ones. I truly appreciate it. It does take a lot of time and financial costs to run the podcast, and it is not a moneymaker, let me tell you. So if you are enjoying this, I would truly appreciate your support just by sending me a post, a like, and a subscribe. Thank you so much.